If you're taking any medications right now, and statistically, you probably are, I need you to listen carefully to what I'm about to share. Because in the next few minutes, you're going to discover something that most doctors don't bring up and most patients never suspect. It's about medications sitting in your medicine cabinet right now that could be quietly affecting your memory and your ability to think clearly. And here's the part that catches people off guard. You might not even realize it's happening. I'm not here to scare you. I'm here to give you information that could change how you and your doctor talk about your health. Because here's the truth nobody wants to say out loud. Some of the most popular, most prescribed, most trusted medications in America can have a side effect that terrifies us all. They can actually accelerate cognitive decline, memory problems, confusion, brain fog, the things we all fear as we get older. Before you panic or think about throwing away your medications, hear me out. This isn't about stopping what your doctor prescribed. This is about awareness. This is about understanding what's really happening in your body so you can make informed decisions with your healthcare provider. Because knowledge is power. And right now, millions of people are taking these medications without any idea that what they're experiencing, that forgetfulness, that cloudiness, that feeling that your thinking isn't quite as sharp as it used to be, might not be normal aging at all. Think about it. How many times have you walked into a room and forgotten why you went in there? How many times have you struggled to remember a name or felt like your thoughts were moving through molasses? Most of us chalk it up to getting older. But what if it's something else? What if the very thing you're taking to manage your blood pressure or your anxiety or your arthritis is actually interfering with the one thing you want to protect the most, your mind? I've researched this extensively, talked to people just like you, and looked at the science behind what's really going on. And I've discovered something important. There are 9 medications, 9 that are commonly prescribed to people over 50 that carry this specific risk. And most people have never heard of it. Most patients are never warned. Most doctors don't even bring it up. But here's where it gets interesting. It's not that these medications are bad. They serve a real purpose. They help people. They manage real health conditions. The problem is that we've been taught to accept the side effects without question. We've been told, well, that's just what happens when you get older. But what if we could do better? What if we could understand exactly which medications carry this risk, why they carry it, and what you can actually do about it? In the next few minutes, you're going to learn which 9 medications these are. You're going to understand exactly how they affect your brain, and you're going to discover the practical steps you can take to protect your memory while still managing the health conditions you need to manage. So let's talk about what's actually happening. Let me start by telling you about Margaret. She's 72 years old, and 3 years ago, she noticed something that worried her. She'd be sitting at her kitchen table with her daughter, and suddenly, she couldn't remember what they'd just been talking about. Her words would get jumbled. She'd start a sentence and forget where she was going with it. Her family thought it was normal aging. Even her doctor didn't seem too concerned. But here's what Margaret didn't know. She was taking 4 different medications regularly. And those 4 medications were working together in a way that was quietly stealing her cognitive clarity day after day without anyone realizing what was really happening. This is where I need you to pay close attention. Our brains use chemical messengers. Think of them like electrical signals that carry information from one part of your brain to another. One of the most important of these messengers is something called acetylcholine. And acetylcholine is absolutely essential for memory, focus, and clear thinking. Here's what's critical. Many popular medications work by blocking acetylcholine. They weren't designed to do this. That's not the main reason they're prescribed, but it's a side effect. And over time, if you're taking one of these medications, or worse, if you're taking multiple ones, you're essentially reducing the amount of this crucial brain chemical that your brain needs to function properly. Imagine your brain's memory system like a filing cabinet. Acetylcholine is what helps you open the drawers and find what you're looking for. When you have plenty of it, everything works smoothly. But when medications start blocking it, the drawers get harder to open. The files get harder to find. Eventually, you're standing there frustrated, knowing the information is in there somewhere, but you just can't access it. And here's what's so dangerous. It happens slowly, gradually. So gradually that you and everyone around you just think it's normal aging. You don't wake up one morning with a problem. Instead, over weeks and months, you notice things aren't quite right. You're more forgetful. Your thinking feels foggy. You struggle to find the right words. You repeat stories because you don't remember telling them before. You feel like you're working harder to do the same mental tasks that used to come naturally, the scariest part. If you keep taking these medications, especially if you're taking multiple ones at the same time, this cognitive decline can actually accelerate. It's not just slowing down your thinking, it can actually speed up the development of memory problems and cognitive impairment. Now, let me be clear, this isn't your fault. This isn't about not eating enough blueberries or doing enough crossword puzzles. This is pharmacology. This is chemistry. This is about what these medications do to your brain at a molecular level. Here's something else that people don't talk about. Doctors don't always connect these dots. You'll see your primary care doctor and they prescribe one medication. Then you see a specialist and they prescribe another. Maybe you visit urgent care and they add something else. Nobody's looking at the whole picture. Nobody's saying, wait, this medication blocks acetylcholine, and so does that one, and that one over there. Together, they're creating a significant problem in your brain. This happens constantly. A woman comes in with anxiety, gets prescribed a certain medication, then she develops arthritis, gets prescribed another. Then her blood pressure goes up, gets a third medication. Now she's on 3 different drugs, and nobody has calculated the combined effect on her brain chemistry. So let me ask you something. How many prescription medications are you taking right now? If you're like most people over 60, you're taking at least 3. Some of you are taking 6, 8, or more. And if any of those medications affect acetylcholine levels, you need to know about it. Because here's what I want you to understand. Memory loss and cognitive decline are not inevitable parts of aging. They're not something you just have to accept. Yes, our brains change as we get older, but there's a massive difference between normal, gradual cognitive aging and the kind of cognitive decline that can be triggered or accelerated by medications. The good news is that once you know which medications have this effect, you can actually do something about it. You can talk to your doctor, you can explore alternatives, you can adjust dosages, you can make informed decisions instead of just passively accepting whatever happens to your brain. But first, you need to know which medications we're actually talking about. So here are the 9 medications. Listen carefully, because if you or someone you love is taking any of these, this information is crucial. The first is diphenhydramine, known as Benadryl. You've taken this for allergies. You've given it to your grandchildren. It's in your medicine cabinet right now. Over the counter, no prescription needed. Feels completely safe. But diphenhydramine is one of the most powerfully anticholinergic medications available. It blocks acetylcholine in a major way. If you take it occasionally, that's one thing. But many people, especially older adults with chronic allergies or sleep problems, take this regularly. Some take it every single night to sleep, every single night for months or years. And they have no idea that they're telling their brain to reduce the very chemical that keeps memories intact. Next is oxybutynin, prescribed for overactive bladder. And I know how real that problem is. You're in the grocery store and suddenly you need a bathroom right now. You're at your grandchild's soccer game and you're spending half the time looking for a restroom. It disrupts your life. So you get oxybutynin. It works. The urgency decreases. But what's happening in your brain? That same anticholinergic effect. You're trading one problem for a potentially worse one. Then there's tolterodine, which is similar. Same purpose, same mechanism, same effect on your brain. If you're taking either for bladder issues, listen carefully to what comes next, because there are alternatives. Then we have amitriptyline and nortriptyline, tricyclic antidepressants. They've been around for decades. They're prescribed for depression, but also for chronic pain, fibromyalgia, and nerve pain associated with diabetes. Many older adults are on these. Yes, they can help with depression and pain, but they're powerful anticholinergic drugs. So you're taking a medication to help your mood or your pain, but you might be accelerating memory loss at the same time. There's also benztropine and trihexyphenidyl. These are less common unless you have Parkinson's disease, but if you do, you need to know about this. They're prescribed to manage Parkinsonian symptoms, but they carry significant cognitive risks. Then there are antihistamines beyond just Benadryl. Things like hydroxyzine, prescribed for anxiety, or chlorpheniramine. Various over-the-counter antihistamine combinations that people take for colds and allergies without thinking twice about what they might be doing to their brain. And finally, muscle relaxants like cyclobenzaprine, prescribed for back pain, neck pain, any muscle tension, very commonly prescribed. But again, anticholinergic effects. Now, I know what you might be thinking. My doctor would have told me about this. My pharmacist would have warned me. That's reasonable. But here's the reality. The warning is technically there. If you read the fine print in the package insert, that tiny print that comes with your medication, you'll see it listed as a possible side effect. Dizziness, drowsiness, dry mouth, and somewhere in there, memory problems or confusion. But it's buried. Nobody emphasizes it. Nobody says, hey, if you take this medication long term, it could actually accelerate cognitive decline. Here's another thing. If you're on multiple anticholinergic medications, the effects don't just add up, they multiply. Your brain's acetylcholine gets depleted more and more. Cognitive problems become more likely. This is especially important if you're in your 60s, 70s, or 80s. Why? Because your brain is already more vulnerable. As we age, our brains naturally produce less acetylcholine. So when medications block what you have, the impact is more severe. A 30-year-old who takes Benadryl might feel drowsy, but won't necessarily notice memory problems. A 75-year-old taking the same medication might experience significant cognitive fog. Let me tell you about something called the Beers criteria. This is something that geriatricians, doctors who specialize in older adults, are taught about. It's basically a list of medications that should be avoided or used with extreme caution in people over 65 because of cognitive risks. Most of the medications I just mentioned are flagged as potentially dangerous for older brains, but most people never see a geriatrician. Most see their regular doctor or specialist. And most of those doctors aren't trained to think about medication interactions in terms of cognitive risk. They're trained to treat your blood pressure or your bladder problem or your anxiety, but they're not always trained to think about the cumulative effect on your brain. This is why knowledge matters so much. This is why you need to know what you're taking, because your doctor might not be thinking about this the way they should be. The research is clear. Study after study shows that people taking multiple anticholinergic medications have higher rates of cognitive decline and higher rates of dementia diagnosis compared to people not taking these medications. Some studies show that the more anticholinergic medications you take, the faster your cognitive decline happens. And here's the part that should matter to you. This has been known for years. Scientists have understood this. Researchers have published this, but it hasn't filtered down to everyday doctors, and it definitely hasn't reached everyday patients. So now you know which medications we're talking about. You know they work by blocking acetylcholine. You know that acetylcholine is essential for memory and thinking. And you know that when these medications accumulate in your system, especially if you're taking multiple ones, the risk to your cognitive health becomes significant. But here's what you still need to know. What can you actually do about this? Here's what I need you to understand first. You're not trapped. If you're taking one of these medications, your life isn't over. Your memory isn't doomed. But you do need to take action. The first thing you need to do is sit down with your doctor and have an honest conversation about every medication you're taking. Not just the prescription ones, the over-the-counter ones too, the Benadryl you take occasionally, the antihistamine cold medicine, the muscle relaxant you use for your back, all of it. Bring a list. Write down the names, the doses, how often you take them, and why you're taking them. Your doctor might not have realized you're combining multiple anticholinergic medications. Once you point it out, they can actually help. Now, here's something really important. Do not stop taking these medications on your own. Do not go cold turkey. If you're taking an antidepressant, stopping it suddenly can be dangerous. If you're taking a medication for overactive bladder or anxiety, stopping without medical guidance can cause problems. This isn't about quitting. This is about working with your doctor to find alternatives. And here's great news. Alternatives exist. For almost every medication on this list, there's something else that treats the same problem without the cognitive side effects. If you're taking oxybutynin or tolterodine for overactive bladder, there are newer medications like mirabegron that work differently. They don't have the same anticholinergic effects. They're newer, they're safer for your brain, and they work just as well, sometimes better. I know a woman named Susan who switched from tolterodine to mirabegron. Not only did her bladder problem continue to improve, but within 2 months, her memory fog cleared up. She could remember conversations. She felt like herself again. For allergies and sleep problems, instead of reaching for Benadryl, there are better options. Talk to your doctor about alternatives. There's melatonin, which is natural and doesn't have the same cognitive risks. There are newer antihistamines like cetirizine or loratadine that have much less anticholinergic activity. For allergies, these work well and won't cloud your thinking. If you're on an antidepressant like amitriptyline or nortriptyline, there are definitely alternatives. SSRIs like sertraline or escitalopram work differently. They help depression and anxiety without the same cognitive side effects. It might take time to switch. You can't just jump from one to another, but your doctor can manage that transition safely. For muscle pain and spasms, instead of cyclobenzaprine, there are other approaches. Physical therapy, heat therapy, and gentle exercise often work better long-term anyway. If you do need medication, there are options that don't have the same brain effects. But here's where I need to be honest. Sometimes switching medications isn't as simple as I'm making it sound. Sometimes the alternative doesn't work quite as well. Sometimes the cost is different. Sometimes your insurance won't cover the newer option. Sometimes you've been on the same medication for years and you're genuinely worried about changing it. All of those are legitimate concerns. Your doctor needs to help you navigate them. This is why the conversation is so important. You're not just walking in and saying, I want a different medication. You're walking in with knowledge. You're saying, I've learned that this medication I'm taking has anticholinergic effects, and I'm concerned about my cognitive health. Can we talk about alternatives? That changes the conversation. That makes your doctor take you seriously. While you're having that conversation and potentially making those switches, there are things you can start doing right now to protect your brain. First, movement. Your brain needs you to move your body. When you exercise, you increase blood flow to your brain. You boost the production of chemicals that protect brain cells. You literally build new neural pathways. This isn't about running marathons. This is about a 30-minute walk 5 days a week. That's it. Just walking. The research is shocking. People who walk regularly have significantly less cognitive decline than people who don't. Some studies show that regular walkers have brains that are years younger cognitively compared to sedentary people their age. Second, sleep. Real sleep. Not the kind you get from taking Benadryl every night. I'm talking about 7 to 9 hours of quality sleep where your brain can actually consolidate memories and clear out toxins. During sleep, your brain literally washes itself. It clears out metabolic waste products that build up during the day. One of those waste products is beta amyloid, which is associated with dementia. So when you're not sleeping well, that stuff accumulates in your brain. Third, cognitive engagement. Use your brain, learn something new, do puzzles. Read challenging books, have conversations about interesting topics, learn an instrument, take a class. Your brain, like a muscle, gets stronger when you use it. Studies show that people who stay cognitively engaged have better memory and lower rates of dementia. Fourth, social connection. This is huge and often overlooked. Loneliness is as toxic to your brain as smoking is to your lungs. When you spend time with people you care about, when you have meaningful conversations, when you feel connected to your community, your brain thrives. Your memory works better. You're less likely to develop dementia. Isolation does the opposite. Fifth, what you eat matters. Your brain is made of fat. It needs omega-3 fatty acids. It needs antioxidants from colorful vegetables. It needs B vitamins, a Mediterranean diet, lots of olive oil, fish, vegetables, whole grains, nuts, has been shown to protect brain health. It's not fancy. It's not complicated. It's just real food that nourishes your brain. Now, here's something important. Even if you're doing all of these things perfectly, if you're taking multiple anticholinergic medications, you're still at risk. It's like trying to keep a plant healthy while slowly draining the water from its roots. You can give it sunshine, good soil, and nutrients, but if you're draining the water, eventually it's going to wilt. These lifestyle changes support your brain health. They're essential. But they're not a substitute for addressing the medication issue. Let me bring this back to something really simple. You've just learned something that most people will never know. 9 medications, anticholinergic effects, brain chemistry, acetylcholine. You now understand a connection between common medications and cognitive decline that billions of people walk around not knowing about. But knowledge without action is just information. So let's talk about what you actually do with what you know. Here's your action plan. It's not complicated, but it's important. Step 1. This week, make a list. Write down every single medication you're taking. Include the name, the dose, and why you're taking it. Include over-the-counter medications. Include supplements. Everything. Step 2. Before your next doctor's appointment, do 5 minutes of research. Go online and search for each medication plus the word anticholinergic. You'll find information about whether that medication blocks acetylcholine. You don't need to become an expert. You just need to know which ones do. Step 3. At your next appointment, have the conversation. Bring your list. Say something like, I've learned that I'm taking multiple medications that have anticholinergic effects, and I'm concerned about what that might mean for my memory and brain health. Can we talk about alternatives? Your doctor might already know about this. They might be relieved that you brought it up, or they might need to do some research themselves. Either way, you're starting a conversation that matters. Step 4. If your doctor recommends switching medications, work with them on a safe transition plan. Don't rush it. Don't stop medications suddenly, but do move forward. Step 5. While you're doing this, start the lifestyle changes if you haven't already. Walk. Prioritize sleep. Engage your brain. Connect with people. Eat real food. These take time to show results, but they work. Now, I know what some of you might be thinking. This is overwhelming. My doctor prescribed all these medications. They must be safe. Your doctor prescribed them because they solve real problems. Your anxiety is real. Your pain is real. Your bladder issues are real. Your depression is real. These medications do help. The issue isn't that the medications are bad. The issue is that we've never had a full, honest conversation about the trade-offs. We've never sat down and said, yes, this medication helps with your anxiety, but here's what it might do to your brain. Let's talk about whether there's a better option. That's changing. More doctors are becoming aware of this. More research is coming out. More patients are asking questions. You're part of that change just by knowing this information and being willing to talk about it. Here's something else I want you to know. If you're already experiencing some memory problems or cognitive fog, it's not too late. I've seen people in their 70s and 80s make significant cognitive improvements by switching medications and making lifestyle changes. The brain wants to heal. It wants to work properly. Give it the chance and it will. I want to tell you about Robert. He was 74. Noticed memory problems. His daughter suggested he start exercising, eat better, do brain games. He did all of that. He walked every day. He started playing chess with friends. He changed his diet, and his memory got slightly better, but it still wasn't right. Turns out he was taking 3 different medications with anticholinergic effects. Once his doctor helped him switch those medications to alternatives, and he kept up with the exercise and the healthy eating, his cognitive function really improved. The medication switch was the key, though. The lifestyle changes supported that improvement. Here's something else that's important. Time matters. If you've been taking anticholinergic medications for years, the cognitive effects can take time to reverse. It's not like you switch medications one day and your memory comes back the next. But many people do see improvement within weeks or months. The brain is resilient. Given the right conditions, it can heal. One more critical thing. If you or someone you love is starting to show signs of cognitive decline, memory problems, confusion, or any concern about dementia, get it checked out. See a doctor. Get cognitive testing if recommended. Why? Because if it's medication related, catching it early makes a huge difference. The sooner you switch medications, the better your recovery. But also because if it's something else, if there's a genuine medical condition, you want to know that too. You want to address it. You want to get the right treatment. Don't just assume it's normal aging. Don't just accept that your memory is going to get worse. And don't just passively accept whatever medications you're on without question. Let me be absolutely clear about one final thing. Don't let the fear of medication side effects stop you from getting help for the things that genuinely need help. If you're depressed, get treatment. If you're in pain, address it. If you're struggling with anxiety or bladder issues, don't just suffer in silence, but get that treatment in a way that protects your brain. Ask questions, explore alternatives. Work with your doctor to find the solution that helps the problem you're trying to solve without creating a new problem with your cognitive health. You deserve to get older while staying sharp. You deserve to keep your memories. You deserve to think clearly. That's not a luxury, that's a basic right. The conversation you have with your doctor next week might seem like a small thing, but it could change everything. It could protect your memory. It could preserve your independence. It could give you years of clear thinking instead of years of fog and confusion. That matters. You matter. Your brain matters. So take action. Make that list. Have that conversation. Explore those alternatives. Start moving your body. Prioritize your sleep. Stay engaged. Connect with people. Take control of your health in a way that protects the one thing that makes you who you are, your mind. You've got this, and you're not alone. Millions of people are starting to have these conversations right now. The awareness is growing. The alternatives are available. The time to act is now. If this information helped you, or if you think it might help someone you love, please share it. Send it to your kids. Send it to your friends. Post it where other people can find it. Because the more people who know about this, the more conversations get had, the more lives get changed. Thank you for listening. Thank you for caring enough about your health to learn this. And thank you for taking the first step toward protecting your brain. Your future self will thank you.